The surge in COVID-19 cases has raised concern about hospital bed shortages. Health officials indicated that although the respiratory hospital will hold some 126 patients upon completion, 82 beds are currently available for use. St. Lucia confirmed 21 new COVID-19 cases. 13 of the new cases were recorded on Saturday, November 7th. 5 of the 13 cases were captured through the contact tracing process. Chief Medical Officer Dr. Sharon Belmar-George confirmed that the 8 new cases recorded on Sunday brought the total number of patients in care to almost 100.
Cases 124 and 131 are linked to case number 78. Cases number 126 and 127 are linked to case number 68. Cases number 129 and 130 are linked to cases number 70, 71, 72, and 73. As per protocol, arrangements have been made for the transfer of these individuals into care. These new cases now bring the number of active cases currently in country to 99.
Anxiety over the case tally comes amid a now viral video of a male COVID-19 patient complaining about conditions at the respiratory hospital. In the video, the man claims he has been placed in a makeshift ward due to a lack of space, pointing out what he perceives as a number of health hazards. Health Minister Mary Isaac says the man has since been transferred.
That was one individual, and we all know that there are renovations taking place at the hospital. We have had to speed up the renovations because now we have the spike in COVID. Unfortunately, it's not anybody's fault, but we have to deal with that issue. So the gentleman has been moved to another ward that is a little bit better. But we do have these conditions there right now, and until we have finished the renovations, we expect, that, people will have to put up with some conditions that are not necessarily up to standard.
The executive director of the OKEUH and the Victoria Respiratory Hospital, Nancy Francis, in a press statement last week, disclosed that some COVID-19 patients are heading to the Turning Point Rehabilitation Centre as the hospital reaches its limit. Isaac says the government is renovating all healthcare facilities to accommodate the increase in patients.
The stadium is up and running. The St. Jude Hospital is up and running. There are no issues. They are expanding on it. They are getting more rooms and things like that. We are retrofitting everywhere because that type of spike, we really did not expect it, given that we kept telling people, follow the protocols, adhere to the protocols. And if people do that, we will be able to control what is going on out there. But a lot of people are, acting as though this is not real. And it is time they wake up and understand that this is a real problem.
Chief Medical Officer Dr. Sharon Belmar-George had declared that if the country records some 50 cases in 2 weeks, health officials may revert to previous phases in the gradual approach to reopening the country. However, Health Minister Isaac says this is unlikely given the fragile state of the economy. Colby DeVoe, HDS News Force.